Okay, good afternoon, everyone. Welcome back. We're about to start our third talk from our speaker, Kathy Georgiades. Kathy confessed to me she was a bit nervous about this talk because she is coming into a field of educators and cognitive psychologists, so she feels a bit like she's coming to this den of wolves. But I told her we're very friendly wolves, so everything is going to be just fine. I'll give you a little bit of background about Kathy. She is an associate professor in the Department of Psychiatry and Behavioral Neurosciences at the Offord Center for Child Studies here at McMaster. She holds the David R. Offord Chair in Child Studies and is supported by a CHR New Investigator Award. Her program of research examines the nature, causes, and effective responses to reducing inequalities in child and youth mental health and academic achievement. Emphasis is placed on specific populations, for example, children and youth from immigrant and ethnic minority backgrounds, and specific contexts, for example, schools, where interventions can be implemented to reduce inequalities. She is currently co-leading a province-wide study, the 2014 Ontario Child Health Study and School Mental Health Surveys, that will provide up-to-date evidence on the mental health needs and service utilization patterns of children and youth in Ontario. And with increasing awareness of mental health, I think it was particularly interesting to have Kathy come to our symposium this year and see if we can try to understand possible connections with cognitive function and education. Please join me in welcoming Kathy.
Thanks very much, Joe, for inviting me to present today. And you're absolutely right, I was quite nervous. My background is in clinical psychology, but much of my research now is sort of epidemiological in nature, and so quite different probably from the methods and the way cognitive psychologists think. And really what I'd like to do today is probably my main objective is to raise awareness about the importance of children's mental health and thinking about mental health when designing evidence-based educational policies and programs. Really, that's the main take-home message. Mental health matters. It matters to academic achievement, and in designing interventions, we need to think about it. So the objectives for today are to raise awareness, as I mentioned, about the importance of considering student mental health, and then to present some local evidence that we collected here in Hamilton to demonstrate the strength of association between mental health and academic achievement. Does it exist, and what's the nature of this association? And to begin to identify potential modifiable variables that might account for this association. Why does this association exist, and how can we potentially intervene to improve academic and mental health outcomes for students in our populations? And finally, I'll end by describing a province-wide study that we just finished completing, where we're really trying to characterize what schools are doing to promote and support student mental health and academic achievement at a province-wide level. So what do we know about children's mental health in Ontario? Well, our evidence is quite outdated. It's based on 1983 data, and that's why we're repeating a province-wide study of children's mental health today. But the estimates, I would assume, are roughly going to be similar to what we found back in 1983, or what the Offord Center found back then. So it's estimated that about 20% of children and youth are suffering from mental health problems that cause significant impairment in multiple domains of children's functioning: academic, interpersonal, social relational. We also know that mental health problems have a very early onset. So 50% of adult mental disorders begin in childhood or adolescence. So again, it speaks to the importance of early intervention. If these problems are emerging during this developmental period, let's intervene as quickly as possible. We know that mental health difficulties are associated with concurrent and longer-term impairments and distress, and that these impairments cut across a variety of domains of functioning. They're not only focused on poor mental health across the life course, but they spread to other domains. So children with mental health difficulties often have academic difficulties, interpersonal difficulties. So again, it's speaking to the importance of intervening before we start to see this spread in problems in other areas. I think the most concerning statistic that's repeated in American studies and studies in the UK is that very few children with mental health needs are receiving services. So there's high levels of unmet need in our population and high levels of burden beyond mental health. And if less than 25% of children with a mental health problem are actually receiving services for those problems and help for those problems, we need to do something about it. And the argument that we believe a context that we believe will help address the barriers that many families are experiencing in accessing and receiving services would be to place interventions and services within schools. And we know that mental health problems have very high economic and personal costs. And so in Canada, one of the leading causes of disability is depression. And so we need to try and intervene and better address the mental health needs of our student population. At the same time, there's this interconnection between mental health and academic achievement. So longitudinal studies that examine achievement in childhood or numeracy skills, literacy skills, early school readiness skills, and predict over the life course educational attainment, and that look at impacts of difficulties in academic achievement in childhood and how it may impact other domains of functioning, we see again this spreading of effects. So children who are struggling academically are at risk as adults to have poor health outcomes, poor mental health outcomes, poor educational achievement, difficulties in finding employment, lower income, and at a higher risk for mortality. So there's clear associations between education and health over the life course. The high school dropout rate in Canada is estimated to be 8%. So 8% of 20 to 24-year-olds in Canada are not attending school and have not graduated from high school. And we know that less than high school education is really associated with a multitude of poor outcomes in adulthood. Another interesting statistic or finding that is quite concerning is that the achievement in math based on Eqao scores in grade 6 is declining over time. So now it's estimated that only 54% of grade 6 students in Ontario are meeting provincial standards. 54%. Now I know the Eqao tests may not be the most valid, but they are an indicator at the population level that we can consider at least. And we know that numeracy skills early in childhood are strong predictors of academic achievement. So how can we promote and support students' learning in a classroom to try and intervene so we're not seeing these poor adult outcomes? And there are clear socioeconomic gradients in educational achievement in children. Children who are born into disadvantaged families, who are raised in families where their own parents' level of education is low, where income is low, we see that they struggle more academically. So again, what can our schools do to support children who are entering into these settings at a possible disadvantage? And there are, as I mentioned throughout the previous two slides, there's some really nice, elegant longitudinal studies of general population samples that are really trying to understand the association between mental health and later achievement. And so here I've listed a couple of studies that have looked at this issue, and they've measured attentional problems, so problems with inattention, problems with hyperactivity based on teacher reports at early school entry, problems with what we call internalizing difficulties. So internalizing difficulties are emotional problems, problems with depression, problems with anxiety, for example, and externalizing problem behaviors in children. So aggressive behavior, defiant behavior, disruptive behavior in children at school entry, and trying to understand what particular types of problems are associated with longer-term educational achievement. And the first study that I cite here by Duncan et al., they examined 6 longitudinal epidemiological studies looking at school entry, what specific mental health difficulties might be predictive of academic achievement at the end of elementary school. And the problems that predicted uniquely to academic achievement were attentional difficulties. So if we control or adjust for emotional problems and behavioral problems, attentional problems at school entry appeared to be a significant predictor of academic achievement at the end of elementary school. And then it's been replicated in Canadian data too by Romano et al. And then Josh Breslow in a subsequent study used a similar set of predictors to try and disentangle what specific types of mental health problems might be associated with academic achievement at the end of secondary school at the age of 17 years. And again, out of those 3 predictors, emotional problems, behavioral problems, and attentional difficulties appear to be at the core of this association. I'd like to draw attention, though, to the sort of more mixed results on internalizing problems, problems with depression, problems with anxiety. And while these previous studies didn't find an association at school entry, if we measure emotional problems in middle school, so children in grades 6, 7, and 8, and examine their longer-term outcomes in terms of educational achievement, there's evidence to suggest that at that developmental period, you begin to see an association between depression and anxiety and poor educational achievement. And I think that's middle childhood is a time where we start to see dramatic increases in depression, and particularly gender gaps, where girls are starting to really increase in terms of levels of depression. And so I think the association between mental health and achievement and the types of mental health problems linked to achievement might be age-specific as well. And that emotional problems may become more pertinent and influence achievement a little bit later on in middle childhood and early adolescence. But the findings have been more mixed. While these studies provide strong evidence of an association between mental health and achievement, very few studies have really tried to understand the potential pathways. What's connecting mental health and achievement? What could be the underlying pathways or mechanisms that are associated with both mental health and achievement, or what various confounders might be demonstrating this association? And perhaps more importantly, in the area of work we are really interested in trying to understand and document is the impact of schools and the joint influence of schools and what's happening in schools with individual child characteristics to sort of attenuate or exacerbate the associations between mental health and achievement. So are some schools more supportive to the mental health needs of students? And in those schools, do we see a decrease in the association between mental health and achievement? Are schools equipped to have specific strategies in their classrooms and specific resources in their schools to sort of offset the risks associated with mental health and achievement? And really, our province-wide study is really trying to understand that. The joint influence of schools, school strategies, classroom climate, what's happening in those schools to potentially offset some risks that children themselves bring into their classroom settings. And so to begin to understand these associations, we use local data, the Hamilton Youth Study, which has been funded by various agencies, Canadian Institutes for Health Research, the Ontario Mental Health Foundation, and an ERA award, and Ontario Child Health Study, School Mental Health Surveys, again funded by CIHR and Ministry of Health. And these studies are really designed to sort of take an ecological framework and understand child development as a dynamic interaction between children's characteristics and the social settings in which they live in and go to school, for example. So we're really interested in understanding the social contextual influences on children's development and children's own characteristics and how they interact to contribute to this association between achievement and mental health. So using data from the Hamilton Youth Study, we started to look at the strength of the association between mental health and achievement. We're interested in seeing whether that association may be spurious and linked primarily to socioeconomic and demographic risks that children often have that characterize children with achievement difficulties and mental health difficulties, and also to control for cognitive ability. So when we control for cognitive ability, when we control for household income, parental education, family structure, all the demographic risks that we know are jointly associated with these outcomes, do we continue to see a mental health to achievement associations? And if we do, is there evidence for specificity? Is it attentional difficulties? Are there emotional problems uniquely associated with achievement? Are there behavioral problems uniquely associated? And finally, to look at how educational expectancies, teachers' expectancies of how well students will do in the classroom and how far they will go in school, youth's own expectancies of how well they're doing in school, and also teachers call these learning skills. I think they really tap into social and emotional functioning of children, how those may be contributing jointly to academic achievement and mental health. So we use the Hamilton Youth Study to answer those questions. The Hamilton Youth Study is what we call a two-stage stratified random sample. So what we did is we selected schools on the basis of diversity. So we're really interested in immigrant populations, but today I'm not going to be talking about immigrant populations, but it's important to understand the sample. So what we did is we categorized schools with low concentration of immigrant students, moderate concentrations, and high concentrations. And in each of those schools, we selected a random sample of students. 40 students per school, and those students were also stratified on the basis of immigrant status. So it's truly a representative sample of 36 schools in Hamilton, and it includes 1,456 students. What we did is we conducted structured face-to-face interviews with parent and youth separately. We collected teacher questionnaire data, and we accessed school administrative data with parental consent. We were very interested in engaging non-English speaking populations because much of our research in our country requires families to speak English to participate. And so what we did is we translated and back-translated all of our instruments, hired a team of interviewers who spoke 14, 15 different languages to engage as many populations as possible and not exclude families on the basis of language. And as a result, we had, I think our response rate was 80%, so we did phenomenally well, and I think a very important strategy to engage ethnically diverse and linguistically diverse populations is matching your language to these populations, obviously. And so our sample is quite diverse. 42% are white, 16% are South Asian, 9.5% are black, and so on. The mean age is 12.1 years. The gender is about a 50-50 split between males and females, and it's a lower income, lower SES sample with about 36% of families having a total household income before tax less than $25,000. Because of our stratification of schools requiring at a minimum, schools had to have, I think it was 17 immigrant students. So as a result of that initial criteria, we lost some schools that didn't have any representation of immigrant students. And as a result, we know, unfortunately, immigrants settle in low-income areas, and so our sample is a little bit more of a higher risk, higher to reach sample. And I think that's important. In terms of mental health, for the purposes of today's presentation, we're going to rely on teacher ratings of inattention and hyperactivity problems. So teachers are given a set of 10 items, and they're asked to rate the extent to which the individual student that participated in our study exhibited these difficulties, and their dimensional ratings of inattention and hyperactivity. They're also asked to rate internalizing problems, so problems with sadness, problems with worrying, problems with being withdrawn, somatic complaints, and then problems with behavior, so aggressive and defiant behavior and disruptive behavior in the classroom. So these are dimensional ratings of mental health as reported by teachers. In terms of academic performance, we're looking at their report card grades, access through the school board, and then mean Eqao scores across reading, writing, and arithmetic. We asked teachers and youth, separately obviously, to report on educational expectancies. How far do you expect to go in school if it was the youth that we were asking? And how far do you expect this student to go in school? And it ranged from not graduate from high school to graduate from university. It was a 7-point response option. And we feel that this measure of expectancies is an indicator of motivation and engagement in schooling. And we know that expectancies are associated with academic achievement. And then teachers rate students on 6 skills that are called learning skills. They rate them on a 4-point scale. And they really capture what I believe are social emotional learning skills. So children's ability to self-regulate, children's social skills, cognitive regulation. So they're rating children's abilities on how well they collaborate with others, how well they self-regulate, how well do they organize their work, their level of responsibility in their classroom, their willingness to take sort of initiative, and their ability to work independently. So the first question is, how big is the gap, or what is the association between mental health and achievement? So if we look at report card grades, and these are averages across all subjects, and these are students in grades 5 to 8. And along the y-axis, it's their average report card grade at the end of the school year. So if they participate, we took their June report cards. And we see that we divided up children into children that are high risk for mental health problems versus no risk for mental health problems or very low risk. And we look at emotional problems, and the blue bar represents children with no or very little risk, and the red bar represents children that are at risk. We see that children are at risk are scoring about 7 percentage points lower on their report cards compared to children with no suggestive of no risk for emotional problems. If we look at externalizing problems or behavioral problems, we see a similar difference of about 6 or 7%. And if we look at attentional problems, again, we're seeing lower achievement in terms of children with attentional problems. If we convert that into an effect size estimate, the children with mental health problems, internalizing, externalizing, inattention, are scoring almost 1 standard deviation below on their report card. So this is a very large effect. It's a very large difference, and it's unadjusted for anything. So we're just looking at unadjusted differences between children who have emotional behavior or appear to be at risk for mental health problems compared to those who aren't. And if we look at Eqao scores, we see similar differences. So consistently, children with emotional and behavioral problems are scoring lower on Eqao scores compared to those without risk. So the next set of questions are really to try and understand the nature of this association better. Is it that low SES just predicts both, and low SES is a confounder of this relationship, and demographic risk and social contextual risk factors? Is what is underlying this association cognitive ability? So let's control for those things and see how different kids are that have mental health difficulties versus those that don't. Then we wanted to further explore the evidence of specificity. Is it true that these effects are sort of isolated to attentional difficulties, or do we see that children with emotional problems and behavioral problems are also exhibiting academic difficulties? And what role do educational expectancies play and learning skills play in this association? So the analysis we use is similar to a regression, but because our data is hierarchically structured with students in schools, we examine these questions using a multi-level framework. And the beauty of a multi-level framework is that it partitions the variability in our outcome into 2 or 3 levels, depending on how many levels you're examining. So in this case, we're running a 2-level model, which enables us to understand how much of the variation in academic achievement is attributable to schools. And knowing how much variation in our outcome is attributable to schools may enable us to make the case for why school interventions are important. And what it does is it quantifies the extent to which schools differ. So generally, once you account for compositional effects and cognitive ability, do we continue to see some schools where their average report card grades are much higher than other schools? And this is after accounting for individual risks and student composition. And if we do, then that speaks to the importance and the potential for schools to be impacting student mental health, student academic achievement, and so on. So multi-level modeling really helps us test out this ecological framework and the importance of social settings in influencing student mental health and student achievement. And so when I show the next 2 slides with coefficients, I'm going to be presenting standardized beta coefficients, and they're interpreted in exactly the same way as ordinary least squares beta coefficients. And I've standardized them to help us compare the magnitude of associations across multiple predictors. So a small effect is considered something in the range of 0.2, a medium effect size of 0.5, and a large effect size of 0.8. So I'm going to walk through these findings with. So what we did is we built a model to try and really understand the association between mental health and academic achievement as indicated on report card grades. The first column, what we did is, so we saw the unadjusted associations. We saw the Cohen's d of almost 1 standard deviation difference on report card grades. Once we account for socioeconomic and contextual risk factors, poverty, parental education, family structure, immigrant status, language, and once we control for cognitive ability assessed by us, do we continue to see a mental health to academic achievement association? And that first column clearly demonstrates that. So we can see that inattention and hyperactivity problems are still negatively associated with report card grades. Now the coefficient is much smaller at 0.3 compared to the Cohen's d that we saw before. But we are seeing a moderately effect size for the association between inattention and report cards. We also see something that those longitudinal studies didn't report on. We also see a unique association between problems with emotion, problems with anxiety, depression, and report card grades. So both of these types of mental health problems are uniquely contributing to academic achievement after accounting for socioeconomic risks and cognitive ability. The other really important number here is this intraclass correlation coefficient of 7.8%. And what this tells us is after we account for student composition, we continue to see significant between-school differences on levels of achievement, with some schools having much higher report card grades than others. And again, that speaks to the importance of schools as a potential site for interventions and really provides the evidence for really examining what's happening in our schools that might be contributing to better performance in some schools and weaker performance in others. Once we add in youth expectancies in the second model, we're trying to see whether the addition of youth expectancies, does it explain some of this mental health to achievement association? And what we see is the addition of educational expectancies isn't really explaining much of the association between mental health and report cards, but it is associated with report card grades. So children who have higher expectations are doing better in school, which is not surprising. But what this speaks to is the importance of understanding classroom context and teaching strategies that help mobilize and motivate students to do well in school. There must be characteristics within a classroom, or I would imagine there are characteristics within the classroom that teachers are doing and the ways teachers set up their classroom that may help motivate students to do well and help instill a level of expectation that will help promote better achievement in these students. Once we account for these learning skills that teachers report on, cooperation, initiation, independent work, self-regulation, we see that much of the association between mental health and achievement is explained. And so at the core of this association between mental health and achievement, our findings would suggest are these learning skills, these social emotional learning strategies. If we learn how to promote those strategies in our classroom, we may help address simultaneously some mental health difficulties that students might be experiencing and help promote academic achievement. So at the core of the association are these learning skills. And we also see in the final model, we add teachers' expectancies. And we also see that teachers' expectations, even after we account for ability, mental health, socioeconomic status, teachers' expectancies are playing a moderately strong role in academic performance. And so how do we instill the importance amongst teachers and educators that we should believe in students despite having mental health difficulties, despite perhaps having some learning skills deficits, the importance of still expecting students to do well in school, because feeling that from a teacher can help promote and set the stage and the setting for youth to try harder and to be motivated and to stay engaged. If we look at the results for Eqao scores, I won't go into them in detail, but pretty much the same pattern of findings hold. We find significant between-school variation, but it's much smaller at 3.2%. We find unique associations between inattention and internalizing problems, and learning skills, again, are contributing a lot to this association. So I think, to summarize, this significant between-school variation in achievement really speaks to the importance of school settings as context for interventions, and to begin to understand what characteristics in schools are either promoting achievement and what characteristics in schools might be undermining achievement. School safety, school climate, school belonging, all of these factors are likely to play a role in children's engagement in school, in children's motivation to stay in school, and in children's achievement. We see that problems with inattention and hyperactivity and internalizing problems are uniquely associated with academic achievement. And so targeting those problems, now we're not looking at children in a categorical fashion. These measures are continuous measures. So screening for children or identifying children with these difficulties early on may be important for intervening in terms of improving mental health outcomes and also achievement outcomes simultaneously. And these learning skills and teachers' expectancies are strong correlates of achievement after accounting for a lot of other factors. We're still seeing fairly strong associations between learning skills and teachers' expectancies, and I think these are potential targets for intervention. So schools are important settings. Joint interventions that target these learning skills and also target characteristics in school context will likely result in improved achievement outcomes and academic mental health outcomes. And while the Hamilton Youth Study helped us explore some of these associations, the province-wide study that I'll talk about next is really helping us chart specifically what schools are doing across Ontario to support mental health, to address student mental health needs and achievement needs. So we literally just completed our school mental health surveys this year. We started data collection in January and we ended in June. And the school mental health surveys are part of a larger study, the Ontario Child Health Study, which is a province-wide epidemiological study of psychiatric disorder. And in the Ontario Child Health Study, what we're doing is we're sampling 180 neighbourhoods across Ontario. These neighbourhoods are divided into low-income neighbourhoods, moderate-income neighbourhoods, and high-income neighbourhoods. And within those neighbourhoods, we're sampling families. So again, a general population sample stratified or divided by neighbourhood income and also family income. And within those 180 neighbourhoods, what we did is we selected the schools in those neighbourhoods to do school-wide assessments of student mental health and achievement, and to assess specific strategies that schools are embracing and using, and assess school climate to understand the nature of association between schools and student mental health and achievement. Yeah, so I think I've covered off everything there. So the objectives of our school mental health surveys are to determine the role of schools in impacting student mental health and achievement. And we're dividing up school characteristics into school resources, school and classroom strategies, and social processes. And we're trying to understand how components of these various characteristics might serve to promote mental health and achievement, address student mental health needs, and reduce inequalities. We're really interested in inequalities in mental health and achievement and how schools might be in a position to offset some of the risks that low SES children experience at home and in their neighborhoods. Can schools help sort of level the playing field for children who are born into disadvantaged circumstances by providing environments that are supportive to help motivate students, to help structure their environments in a way that will be conducive to learning and conducive to well-being more generally. In terms of school resources, we ask principals to tell us the types of staff they have dedicated to mental health, staff dedicated to special education services, agreements they have in place with community providers, and in-school services that they have dedicated to mental health and special education. In terms of school and classroom strategies and processes, we ask teachers, students, and principals to report on various factors in this second bullet point here. So are schools delivering universal or targeted mental health programs or social emotional learning programs? And what types of, we're really interested in moving beyond the implementation of programs and trying to understand day-to-day strategies that are easily implemented by teachers in their classrooms, rather than trying to implement evidence-based 32-week-long interventions. Are there core components and core strategies within these programs that teachers can adapt and implement into their classrooms to support mental health and achievement? So we ask for students and teachers and principals to report on school climate, the nature of relationships in schools, the clarity of expectations, school belonging, school safety, emotional climate, behavioral management strategies, social, emotional, and cooperative learning strategies, and how teachers respond to student mental health needs in their classroom in that moment. What do they do if a child appears to be struggling with depression? How do they respond to that student? In terms of outcomes, we're looking at mental health problems, but we're also interested in positive mental health, academic achievement, engagement in extracurricular activities, suspensions, bullying, discrimination, physical health, well-being, substance use, access and use of mental health services. So our sample includes 258 schools across the province, 187 elementary and 71 secondary schools. We managed to survey 31,148 students in grades 6 to 12 across Ontario, 3,374 teachers, and 206 principals. And our data collection approach, these are large epidemiological studies, so cognitive psychologists are probably cringing. But we collected anonymous student surveys in the classroom, asking them to report on the various dimensions I just presented. Teachers complete a survey in their classrooms, and principals. So it's all survey-based methodology, and data collection occurred in the schools mostly during class time. And so we believe that through this work, we'll be able to provide further evidence that schools are an optimal context for mental health promotion, prevention, and early intervention. This is clearly laid out in Ontario's mental health and addiction strategy and in the Ministry of Health and Long-Term Care Action Plan for Healthcare. There's a real emphasis over the past 3 or 4 years on the expansion and the importance of integrating mental health promotion and mental health interventions in our schools, but it's just not clear what precisely is happening now in our schools. And this study will help us document and gain a better understanding of what types of programs and strategies are being implemented to support mental health and, in turn, academic achievement. We believe that social emotional learning programs and strategies really have the potential to improve mental health and academic achievement jointly. So we're really interested in getting a very clear idea of how teachers are maybe engaged in teaching students, empathy skills, cooperative learning, controlling their impulse, for example, problem solving, social skills. So we're really interested in trying to document what teachers are doing to help support the development of these skills. And we believe that our study will really help provide critical evidence to inform the types of policies and programs that might be implemented in the next few years in our schools. And we're closely collaborating with the Ministry of Education right from the start. They've been partners with us in developing this study, which we hope will help ensure the take-up of our evidence and the integration of our evidence into the policies and programs that they'll be trying to implement in the coming years. And we hope that the school mental health studies potentially will be repeated in a 5 to 7 year time frame. We think that the current study could help provide a baseline to help us evaluate some of the programs and policies that are being implemented in our schools in 5 to 7 years' time. I'd like to thank, there's many people I would like to thank, but a few that are listed here, and our teams that are 40 or 50 people on each of these studies. The 2014 Ontario Child Health Study, Michael Boyles, we're co-PIs on these studies, Laura Duncan, Anna Cata, Melissa Kimber, Olivia and Megan, who helped scan all the data all summer, our Hamilton Youth Study team, and the schools, the principals, staff, students, families. It was an incredible endeavor to be able to implement the school surveys this year, especially in the context of what was happening politically near the end. But schools saw the value in it, and I think we'll be able to gather some really strong evidence to help us support students' well-being, mental health, academic achievement better in the coming years. So thank you very much for the opportunity to present. No.
Okay, we have time for some questions from the audience. I'll start here.
Did you look very much on the issue of how the school may be contributing to mental health problems, especially depression, anxiety?
Well, we will be looking at perceptions of school safety, how they're monitoring on their playgrounds, in their hallways. I'm trying to think of other elements, perceptions of climate. So if students are perceiving that teachers are not supportive of them, that they don't feel that the rules in the school are fair, or that disciplinary practices are fair across racial groups or gender or social groups of various sexual orientations, for example, we are looking at the sort of school climate could be a positive or it could be a risk if it's sort of on the negative side of things. So those are what sorts of things, if you can get more specific, I can say,
sure.
Yeah.
I mean, I have done a preliminary study that needs
Yes.
more data.
Yeah.
In a medical school in Saudi Arabia.
Okay.
And I have found a positive correlation between students reporting symptoms of depression and anxiety and a lack of metacognitive support. So the student doesn't know where they are in the educational process. This uncertainty leads to the learned helplessness model of depression, for instance.
Right.
Also, poor instruction and lack of formative assessment also seem to be contributing to these reports of depression and anxiety. And these are fundamentally in the school themselves.
Yes.
So I was wondering if you had...
And when you say a formal evaluation, do you mean of the child's psychological back, or?
Formative means that the student is again, they will understand where they are in the learning process. These are assessments which aren't necessarily, there's no score associated with them, but they will know where they are.
Right. In terms of
uncertainty there.
right. So we don't have questions like that in our survey, but we do try and get at instructional strategies in the classroom, for example, and how teachers, if teachers go out of their way to talk to students about sort of their everyday activities beyond school. So we're looking at the nature of relationships. If those relationships are perceived to be hostile or non-supportive, then I would say those are risks. If students perceive their schools to be unsafe, then I would say those are risks. And at the aggregate level, we could see, you know, in schools where we see high levels of behavior problems, are those would obviously be associated with, or could potentially be associated with, other mental health domains of functioning as well. High levels of bullying in a school, high levels of discrimination in a school could be associated with. So we are looking at risk factors in relation to mental health problems as well.
Let's go with Dan.
You mentioned that some schools have higher grades on that. Is that because of something the schools are doing better, or is that grade inflation?
Or is that, oh.
Grade inflation.
We see between school differences in Eqao scores too. I don't know what it is. I mean, we try and control for compositional effects of the students themselves, so the risk factors that students bring, but obviously there's probably a lot of other unmeasured variables that I need to be taking into account. But I think what I'm trying to demonstrate, and if we look at mental health outcomes and how much between school variation there are on mental health problems, even reported by a youth or a parent, you still see significant between school variation. I think my point is that we can use these estimates to quantify the potential influence of schools. Now, what mechanism is contributing to those differences, I can't speak to. It could potentially be grade inflation, and maybe more objective measures could help us address that. And potentially with Eqao scores, the between school variation is much smaller. So report cards is 7.2, Eqao is 4%. So that could be a potential mechanism. And also those learning skills, because I think learning skills are more central to report card grades than they are to Eqao scores. So some of the non-cognitive factors probably are contributing to report card grades, and maybe some schools are better at supporting and teaching kids those skills versus others. These are just hypotheses.
A certain degree of grade inflation might actually be helpful. Obviously, if it's too much grade inflation, then people think they're doing well, and they're not really doing well. But maybe there's some possibility that a little bit higher grades actually build confidence, would build motivation, and that might have this interesting effect. You always think of grade inflation as being something that's bad.
Right.
But I wonder if there's like a little window in there where some is good.
Yeah, it's a fascinating idea. And all of these factors, expectations, motivations, how to keep kids, like they're so intricately tied together that it's hard to understand. I mean, trying to tease apart a causal pathway is probably very difficult, but it's an interesting idea that I never thought of.
Let's go to the back.
Thank you for your presentation, and congratulations on the volume of data you collected. That's quite impressive. I think my question is a follow-on to the first question posed, and I'm reflecting on Patrick Dean's comment last night that he asked whether much of our teaching is compensating for the institutionalized structures around learning. And so you've got me curious about this. I'm not sure it's something you've looked at, but to what extent is it possible that the very institutionalizing of learning and the accompanying structures might have a negative impact on some students' mental well-being?
Attention, can you tell me what particular, so can you give me some examples so I can get through a bit more?
Well, I'm just wondering whether some of the students might not have the capacity for adapting to that kind of structure.
Right.
I don't have more examples right now, and Patrick didn't particularly give any. It was just one person in the audience commented around the challenges of timelines on learning, for example, in the post-secondary setting. And I think Patrick's response was saying that that's embedded within learning within an institution, that there is a start and a finish. But I'm just struck by, and I'm still pondering his question about, is a lot of our teaching actually compensating for perhaps challenges that are inherent in the system that we all work in?
Sure, absolutely. And I think the importance of adapting some of our expectations or timelines or requirements for certain populations is key, especially for student well-being. So if these regulations and these rules and these expectations are across the board, then I do think it would be harming some students in terms of emotional and behavioral well-being. Those students that need special, that need exceptions to those rules.
And I guess I'm just wondering whether you'd see the same kind of breakdown if you looked at homeschooled students or other populations.
Right, yeah, unfortunately, yeah, that's a fascinating question, but very interesting. But I don't think we'd be answering, we wouldn't have, we ask more about the classroom strategies that we're interested in, I would say, fall into emotional support between teachers and students and peers to peers, organizational structure in the sense of behavior management, and how they structure their instructional time in terms of encouraging students to work cooperatively, sort of rewarding positive behavior, but we don't actually get at the specifics. So I don't think we'd be able to capture that in this study, but it's an interesting one to consider for future work for sure.
Jonathan?
I'm not sure if it'd be part of the scope of this present study, but would you be able to get access to things like prescribed medications and what's happening in the interim between when you start this, is like start the service and end?
Right.
Because work at the school I worked at, introducing it at critical periods within the school, it can have a patient effect.
Yes, that's a great question. So I didn't get into the details, but the in-home study that we're doing, the Ontario Child Health Study, will get at those issues. So prescription medication, we are documenting it. We're requesting access to link their health record data to see what kinds of physician diagnoses these kids have, what kinds of medications they're on, or been prescribed. So in the in-home study, not the school surveys, but the in-home study, we can do that. So we can link that. And there'll be overlap in the children presenting in the in-home study and the school study. So we'll use we will integrate that data to try and characterize the schools that the students in the in-home study are attending. So we will bridge those two data sources to try and develop contextual measures of schools and bring it into the students that participated in the in-home to understand school influences on far more outcomes than what I presented, and with far better measurement in the in-home study. So we've got youth report, parent report, teacher report, admin data, and so a portion of the sample will be linked and will help us answer some of those questions. And that data, I should talk, that study is being collected by Statistics Canada, and that data will be made available in all research data centers in the country, but not for another year or so. So people that are interested in this type of work, the in-home data will be available for analysis in about a year from now.
Ellen?
Hi, I was actually curious about the integrated reliability between students and teachers. So how aware are students that they're at risk? Is that an important factor?
At risk for
For academic success or just life success? Are they aware that they're at a disadvantage? Do they correlate well with the student measures or the teacher measures?
Yeah, so if we look at correlations between parent, youth, and teacher reports of mental health problems, the correlations are in the moderate range, so 0.4, 0.5. And this is the crux of sort of mental health research with children is who's the best informant on these issues. Is the youth more accurate? Is it the teacher? Is it the parent? Is it report card grades or Eqao scores that doesn't have any sort of rater involved? And it's a really interesting question. And we see similar patterns if we look at parent-reported and youth-reported mental health problems as well, but the correlations aren't perfect. They're definitely in the moderate range. But it doesn't mean that they're wrong. Like, we still don't know who's more accurate. Yeah.
When a child's been identified as being at risk and you're developing an intervention program, does that very fact have any effect on labeling and stigmatizing?
Yeah, and we haven't done that. I'm not sure what the best approach is for interventions, but there are some consequences of labeling kids. And for the purposes of these epidemiological surveys, we just use these categories for classification purposes, but we would never use them to help inform a specific intervention with that student population. It's more from a public health, population health, epidemiological perspective at this point. We haven't taken that second step for intervention yet, but many people speak about the consequences of labeling or misclassifying students. And mental health problems sort of ebb and flow sometimes, so we've got to be careful that our measurement of risk is a true measurement of risk, and we're not misclassifying kids and then developing or intervening at a point where we may not need to. Yeah.
Thank you very much, Kathy.
Thank you.